Good evening, and thank you for joining us for this virtual community town hall addressing COVID-19 in the Fredericksburg region. Mary Washington Healthcare is committed to improving the health of people in our community. We take this commitment seriously, and we know the COVID-19 pandemic continues to raise many questions and concerns for you and your family. Tonight, we're here to share what we know about COVID-19 and what we are doing to keep you safe and healthy. During this town hall, you will hear from our expert panel, and we welcome you to ask questions in the chat during the conversation. Let's meet our panelists. First, we have Dr. Mike McDermott, Chief Executive Officer for Mary Washington Healthcare. Second, we have Eileen Doman, Chief Nursing Officer for Mary Washington Healthcare. And our third panelist is Dr. Christopher Newman, Chief Medical Officer and Chief Operating Officer for Mary Washington Healthcare. Dr. McDermott, I'd like to turn it over to you to start the program and tell our viewers the latest information regarding our region.
Thank you, Emily, and good evening, everybody, and thanks for taking a little bit of time out of your evening to join us for our town hall. Happy New Year to everybody into the year 2021. I know many of us feel, good riddance to 2020, and let's hope for a brighter future here. I'll start by showing our internal dashboard where we're at today. We currently have 85 patients hospitalized who have COVID-19 and need inpatient care to help them battle COVID-19. We've been up actually in the 90s most of the week, so we're down just a little bit here today, but we have been, we had a peak of 99, I believe. We've been in the 90s most of the last week. And so, the caseload here in our region continues to increase. On the graph there, you can see, again, I just want to point out, the yellow line is our number of patients hospitalized on any given day. And look at what's happened to the right of the screen there from November 1st until now in January. The steepness of that curve has not really been flattened. The orange line right on top of it, that's measured in the scale over to the right. That's the number of state hospitalizations. It's up over 2,600 individuals in the Commonwealth, patients in the Commonwealth that are hospitalized battling COVID-19. Higher than it's ever been. It's setting records literally every day. And again, the steepness of that curve has not yet been flattened, and it's very, very concerning. We're heading into a period where the hospitalizations that might occur from holiday gatherings and Christmas and the New Year's holidays are still likely ahead of us, right? We're just here in the first week of January still. That is very concerning and sobering to us as a team. We're also reaching a point, not just in our system, where all the slack that we have built into our healthcare system has been removed, right? It's tight now. There's no more slack left. And we used to always be able to also count on slack in other health systems and hospitals around the Commonwealth that could pick up for us if we got a little tight. But every single hospital and health system in the Commonwealth of Virginia has no slack left. It's tight everywhere. And so we don't have the ability to transfer patients out from our community or take patients in from other communities that might be more overwhelmed. All of that slack is getting removed from the system. That is also very, very concerning for us at this point in time. And so I know I'm preaching to the choir a little bit to the folks that turn in to these town halls, but we need to continue to get the message out to our community that now is the time to stay at home. Don't share your air with anybody else in any indoor environment or outdoor environment. Don't be around other individuals where you can share their air outside of your daily household unit. That's the mindset we have to have at this point in time. If you do need to leave your house for some essential purpose, you need to wear a mask at all times. You need to be masked at all times, and extreme social distancing away from others. Limit your time in any indoor environment. Assume that the air in any environment you enter in any indoor space is contaminated. That's the way you have to think about it. You have to get in and you have to get out. Don't spend a lot of time in there. This is the mindset we have to have if we're going to try and lower the prevalence in our community. I know there's been a lot of talk in the media about the strain of the virus that's out there that is more contagious and spreads more rapidly, and they found it in areas around the country. I think the best way to think about that is assume it's here. assume it's what's driving the increased prevalence in our community. The normal tests we do don't test to see what genetic variant of the virus you have. They just test to see if you have the virus, not the specific genetic variant. And so to do those tests, it takes different equipment and people doing scientific studies. You have to assume that that variant is everywhere. That's the mindset I think everybody should have. Assume that's what's spreading in our community. That'll drive everybody to be safer, right? Don't wait for the first case to get reported in Virginia. I can pretty much assure you that variant is in the state of Virginia and is spreading here in our community. I wanted to just touch base here in my opening remarks too, a little bit about the vaccination effort, right? I know everybody's hearing a lot about the vaccines now. We have 2 vaccines that have received their emergency use authorization from the FDA, the Pfizer and Moderna vaccine. The state has received shipments from the federal government. Unfortunately, when those federal government plans came out, there was no real plans for the last, some people call it the last mile, I call it the last 12 inches, getting that vaccine into the bodies of citizens of the Commonwealth of Virginia. No plans from the federal government for that. We didn't know that that was going to be part of our duties or our job. We were prepared to do that for our workforce, but not the larger community as a whole or healthcare workforce outside of our employee groups. But the fact that there were no plans, we are rapidly rising to the occasion and building capacity to be able to do that for our community. We see that as part of our mission. We didn't think it was going to be our job, but we are in a position to work closely with our local health department and work in partnership with one another to try and get our community vaccinated as quickly as possible. The state and the federal government, the CDC, has come out with a tiering mechanism of who they recommend should be vaccinated first. The first group of those is the 1A individuals, which are, I'm just going to classify those as the healthcare workforce, and those individuals living in assisted living facilities and skilled nursing facilities in the Commonwealth of Virginia, those congregate settings that we know have been very, very dangerous through the pandemic. And so right now, efforts are underway to make sure all of those individuals get vaccinated as quickly as possible. But it takes a lot of logistics to do that and a lot of plans in place to do that. It sounds easy. It is actually harder to do in practice. But we are really ramping up quickly to do that. We have vaccinated thousands of members of our healthcare workforce here so far, and we are really working at a feverish pace to put the capacity in place to do more as quickly as we can. After we get through that 1A group, the governor, if you listened to his press conference yesterday, did announce the other priority groups for the Commonwealth of Virginia. There's a 1B group that includes individuals age 75 and older, as well as some essential workforce members of our frontline workforce, those like first responders, firefighters, police, education, food and agriculture workers, manufacturing, postal service workers, transit workers, those that work in grocery stores. Those are some of the essential functions and groups that are listed in category 1B. Once we get through 1B, there's a 1C category of individuals age 65 and older, those with high-risk medical conditions, and then also some other essential workers like transportation workers, logistic workers, food service, finance, media. There's a whole other list of categories that the governor outlined. And so once we get through those priority groups, then we can get it out to the broader public as a whole. And we want to get there as quickly as possible. We're going to work very, very closely with our local health department and the state Department of Health to help coordinate this effort in our Fredericksburg region. We didn't think this was going to be one of our duties. We thought there would be a larger plan. We haven't seen that yet. So we're stepping in to play that role for our community. We see it as part of our mission. It's the way we're going to help our community be healthier. And that is our mission, to improve the health of the people in our Fredericksburg region. And so the way we can do that is to get everybody vaccinated as quickly as possible. We're going to work our way through those priority groups and then get it out to the larger population of our Fredericksburg region as quickly as possible. Our team has been working so hard on this. I am so proud of everybody who's been part of our vaccination efforts and what they have been able to make happen in just a few days to build the capacity that we're building to move even faster than we've been moving to this point in time.
Thank you so much, Dr. McDermott. That's great information for our community to hear. As you can imagine, the vaccine is a hot topic. There are lots of burning questions that we've been receiving from our community online, in physician offices, and also through HealthLink.
Hey,
And a
one
lot of
other thing, Emily, I wanted to talk about here as we start with the technology, because after our town hall last week, I got a lot of feedback from members of the community about the live chat that's happening in Facebook and all the questions that the community members are posing. I think that's great. But there are some technology issues. You, myself, Eileen, Chris, we're in a Zoom meeting right now. We're actually not in the Facebook environment. We're actually in a Zoom meeting that is being broadcast on Facebook. And so we're not able to see the chat box questions in Facebook happen in real time because we're in Zoom as a platform. And we're relying on some members of our team to transfer those to you, Emily, to pose to us, but there's a lag involved in our streaming to when it's showing up on Facebook. And so it's not exactly real time. So I just ask everybody in the community, please be aware there are some technology issues. We are not dodging or avoiding any questions in any way, shape, or form. I'm happy to give you my 2 cents on any question out there, but we are not able to see the live chat and feed. Don't think that we're ignoring you in any way. It's just a limitation of the technology environment that Eileen, myself, and Chris and you are in.
Very true. Thank you so much for sharing, Dr. McDermott. Going back to the conversation about vaccines and a lot of the great information that you just shared, folks are still continuing to ask how they'll be notified when it's their turn to be vaccinated. Do you have any insights that you can offer to our viewers?
I would say, currently we are reaching out to the healthcare providers in our community and working with the Department of Health to identify those healthcare providers to get them ready to get their vaccines. And so that's group 1A. It's a little different. We do have plans in place, and we're doing some additional builds to our information technology platform to plan for our rollout to the broader community. And so those things are still to come. We're actually building them in our Epic system and our MyChart system that will allow some scheduling of this for the community as a whole. So there's some preparations going on for when we're able to offer that in a broader fashion. Right now in our 1A environment, it's a little bit of a different environment than what it's going to look like when it gets a little broader. So those things are being built right now as we speak. They're going to be ready to deploy really in our internal environment here, getting ready, hopefully in the coming days. That work is going very, very quickly. Our team is working quickly to get that technology in place. So we'll be ready as the vaccine continues to get more prevalent and we start to work our way through these priority groups as quickly as we can.
Thank you. You did mention some more details about the prioritization levels that we are working through from the state. But a lot of folks are wondering about what that specific timeline looks like. So when their priority level will be able to receive the vaccine, is it in 2 weeks or 2 months?
Prediction is difficult. Prediction is difficult, especially if it's about the future, right? And this is about the future. And so if I'm being honest, I don't know. And some of this is the availability of vaccine that's going to be coming into our state from the federal government. And that is an unknown and a question mark on any given week, how much might show up. But then when it comes in, we want to make sure that whatever has come into our region, we have distributed and administered and vaccinated to the priority grouping we're in. So we're in a position to receive more and keep doing that. That's really what I can say at this point in time. It is difficult to predict the overall availability of that vaccine, how much will come into the state, and then what will get to our community that we can administer. But we want to be in a position to administer everything that comes in as quickly as we can so we can get more and we can vaccinate our community as quickly as possible.
Thank you, Dr. McDermott. We know that the vaccine is here and available in our community for healthcare providers, but some folks in our audience have heard that in order to stretch the number of doses and vaccinate more people, that some healthcare providers are receiving just one dose, and instead of receiving that second dose 21 or 28 days later, that dose is then given to someone else so that they have a first dose. in order to, again, stretch out that vaccine quantity. Can you share what that process looks like here and how we are administering the vaccine to our healthcare providers?
Chris.
Yeah, that's not happening locally. That's not been what's recommended formally through the FDA at this point. And to be quite honest, the problem here is really lack of a process to get people vaccinated, not necessarily lack of vaccine right out of the gates. We weren't communicated with very readily about how much vaccine we would get or expect, and really we were charged with vaccinating our healthcare workforce here for Mary Washington Healthcare. Now we've been able to receive a few more vaccines, and in partnership with the Department of Health, because of that, we're committed to getting that to our broader healthcare community as soon as possible. As soon as we got that vaccine, we had teams deployed, really trying to ramp up to 1,000, 2,000 vaccines administered a day. The ongoing supply chain of vaccine is really difficult to predict. Right now, I think across the nation, it's not necessarily the supply of vaccine, it's how quickly we're getting it out to the people who need it. And that's not just in Virginia, that's really across the state. But we're going to stand that up very quickly. And it's really not, we still haven't been tasked with this, I'll be quite honest. It is our mission. We feel like it's our responsibility. In lieu of another plan, we're willing to step up, and we want to make sure that we can vaccinate and protect our community as quickly as possible. And as Mike said, if we can rapidly get through 1A, then we can move to 1B. And as long as we keep getting vaccine, we're willing to partner with the Department of Health and get this out to the individuals that need it as quickly as we can. It's very difficult to stand this up in a day. I think people think, oh, you received 10,000 doses, like those 10,000 doses should be administered the next day. And I do understand that. But, we're stressed as a system. All hands on deck are caring for sick COVID patients. Our system is being overwhelmed like many healthcare systems are. We were not told that we were having this responsibility up front. So there wasn't that initial ability to plan. But rapidly, really in the matter of days, we have built a team. We're getting vaccine clinics up and running, and we are already vaccinating our broader healthcare community. Starting yesterday, really, within a day or two, we were able to stand up that process. And there's some hiccups in the road, but we are going to move forward as quickly as we can, and as quickly as we get a supply of vaccine, we're going to move forward.
One clarifying point for the public that they might not be aware of is that at the federal level and the state level, these vaccines are being administered in what is called a course. And a course is 2 doses. So when you receive your first dose, there is a second dose earmarked for you that will be there on the weeks later when you're set to receive it. It's not like you have to hope they have a second dose ready for you 3 weeks later or 4 weeks later when you're due for that. So the doses they're set in courses or sets of 2 for an individual. So when you receive the first one, there will be a second one waiting for you those weeks later for your second dose to complete your course. Hope that's clarifying in some way.
One other thing that's confusing people, and I've gotten a lot of comments about, Mary Washington Healthcare is not setting the priority schemes. We are not defining 1A, 1B, 1C. That is being defined really by the state in recommendation by the CDC. And there's a lot of debate. Sometimes even some physicians are arguing about why it should be different. We are not setting that. We are following the policy, and each state is doing it a little differently. So literally, somebody who's identified as an essential worker in Virginia may not be in Maryland. And so that is creating some confusion as well with the timelines and the rollout of the vaccine. So it is confusing for the public. There's not been great communication, I don't think, to the public thus far. All I can say is, as long as we are getting vaccine, we are committed to getting it out per the tier system as rapidly as possible. We need to protect our community.
Thank you, Dr. Newman. We are receiving some questions from folks in our community, again, regarding the vaccine and having been diagnosed with COVID-19. So are there any special considerations that someone have had COVID-19, when they should get the vaccine, if they are eligible to receive the vaccine. Dr. Newman, is that something that you can share with our viewers?
Yeah, there's not been a lot of formal guidance on this. We have been conversing with some local experts on this as we've kind of set our own internal policy. And the CDC actually did make some general recommendations, so I can kind of review what those are. Those who've received the monoclonal antibody, so have gotten that really boost to their immune system when they've been sick with COVID, it is definitely recommended at this point that you wait 90 days to get the vaccine. For those who've not had that monoclonal antibody treatment as part of their COVID illness and have just had COVID and recovered, it is felt that you are probably immune and you probably have immunity for at least 90 days. So there may not be an urgency to get vaccinated. That being said, we are vaccinating those who've had COVID and have had recent COVID. As long as they're not acutely ill at the time, we are moving forward with vaccination. That is what we're doing. That appears to be a safe process. And again, we're trying to protect people as quickly as possible. That has not been a formally studied issue, but from experts that we've talked to on a national level and reviewed, I think it's medically sound given the information we have at this time. We've, quite frankly, another point I really want to make is that people get that first vaccine and then they think, I'm bulletproof. Now I can engage in riskier activity, can go on my vacation, can eat at a restaurant without a mask and not have to worry, or go to a bar or go to a party. You are not getting protection. The protection does not start until 12 days after the first dose, and that's when it starts. And you don't get formally fully protected until about a week after the second dose. So unfortunately, we've had some healthcare providers who've gotten that first dose and then 3, 4, 5 days later are coming in with COVID. And we're looking at the safety of when do we give that second dose of vaccine, since now between those 2 doses, they have active COVID. So just a reminder to everybody, when you do get the vaccine, immunity doesn't appear to even start until about day 12 to day 14, and you're not fully immune until about 7 days after the second dose. And even then, these are fairly safe, but nobody's 100% safe. These are 90, 92, 93, 94% efficacy. There's a reduction in COVID, probably a reduction in severity, but it's not impossible to get it. So you still need to mask, you still need to be careful, even after you're vaccinated.
Thank you, Dr. Newman. You actually brought something up that several of our viewers have asked about, and that's the monoclonal antibody treatments. So our viewers are wondering if we have those treatments available, if we're administering them, and if there are any barriers that we're facing to helping make this treatment more available to our patients and our community.
This is something I'm very proud of. Mary Washington, now we've administered close to 200 doses as of this point. We are now giving usually more than a dozen doses a day, and it's continuing to ramp up. So we have, Mary Washington Healthcare has delivered more monoclonal antibodies than any other health system in the state. And I'm very proud of that and our team, because you have to remember there's all this extra added stress on the health system, and we're caring for COVID. And it's really, from a staffing perspective, it's all hands on deck caring for the sickest of us in the hospital. That being said, we did prioritize this because this could be a life-saving treatment, and it could keep people out of the hospital and prevent further stressing of the health system. So we were able to stand it up. We do have doses. I'd have to say the hardest part of this has been identifying the patients in a timely fashion. So this is very important to get this medication infused in the first few days after you've been diagnosed before you start getting very ill. What it does is it boosts your immune system and prevents the virus from replicating through the body, and it kind of halts that severe process in those who have a very high risk of going on to severe COVID disease. So identifying those. So if you feel you're in a high risk category and you are diagnosed with COVID or you get sick, don't wait. We've communicated to all the primary cares in the region, urgent cares, and if you don't have a primary care doctor, or if you even don't have insurance, please come to one of our urgent cares. We will take care of you. we will make sure you get this this treatment either at Stafford or at Mary Washington Healthcare Hospital here in Fredericksburg.
Thank you, Dr. Newman. We do have some other questions coming in from our community regarding visitation. Eileen, we have a viewer wondering if doulas are allowed in the hospital since they are part of a mother's care team. Is that something that you can talk a little bit about?
Sure. So what we've done last week is we did cut back on visitation and really trying to limit the number of people that are in our facilities. And so for moms that come to us that are pregnant and coming to us for their delivery, our policy says that it's one visitor with them. In those situations where there's a doula, we certainly would want to understand more about what is happening in that situation and work with the obstetrician, with the mom to see, there are times when we will make some exceptions, but we're really just trying to limit the overall number of people that the visitors and the people that are in our building that are not normally part of our staff. But yeah, it's hard to limit the visitation, but that's really the purpose behind it.
Thank you, Eileen. Throughout the pandemic, we've received questions and inquiries from our community just asking if it's safe for them to go to the emergency department or for them to go see their primary care physician, either for an illness or a regularly scheduled exam or checkup. What advice or guidance do you as our panel have to offer to our community in those situations?
Yeah, don't neglect getting care that you need. What we learned very early on, there's the mortality rate that we're seeing that's from COVID, but the death rate in our country is far higher than would be expected from COVID just alone. And that is for people who are afraid to come to the hospital, afraid to get care, even getting basic mammograms, cancer screenings. And then they're coming in now with more advanced cancers or other diagnoses, which that's catastrophic. And that's really a secondary outcome of this pandemic. So the hospital is definitely safe. I mean, that's one of the reasons we hate to restrict visitation. We understand the burden that places on patients and families, but safety is definitely number one at the hospital. We have not been transmitting COVID to visitors, patients. People come here and they're safe. They're not leaving our hospital with COVID if they come in without it. So that is just not happening. Same thing with doctors' offices. I know, many of the private practices we deal with, certainly at Mary Washington Medical Group, very, very strict protocols, often not allowing people to wait in waiting rooms, texting people when they can come in. So there's not congregation, there's not social distancing. Just please do not delay care. If you need care, please seek care, and even things like basic screening. You definitely need to do that. You can't put that kind of stuff off for a year and a half as this pandemic continues.
Well, and we've even seen that, right? This fall we've been busier than usual. When we look in our ICUs are very busy, but they're not full of COVID. They're filled with very sick patients. And you can't help but be concerned that are some of these sick people that did put off some of their healthcare needs and now are dealing with catastrophic illnesses that possibly could have been avoided had they come and gotten treatment earlier. And we also know, particularly in our hospitals, the way that we filter air, the way that our HVAC works, it's very different than any other kind of building or any commercial real estate or retail. And so we're always paying attention to what's happening in our buildings and making sure that we're keeping the air clean and the air is circulating or cycles through a specific number of times per hour. These are things that we monitor routinely in the hospital. So yeah, I mean, I tell you, every day I come to work, I feel a heck of a lot safer at work than I do any place else.
We just invested a large sum of money really in transforming one of our units that opened now in December into all the rooms have negative airflow. So for caring for COVID patients, so that even if a door opens, the air is negative, it stays in that room. It's not transmitting through the rest of the hospital, COVID. It is all those rooms have negative airflow on top of the rooms that we standardly have. But as the number of COVID patients have increased, we did invest in that technology throughout. So again, very, very safe situation.
Thank you. We do have some folks wondering specifically about the emergency department, what kind of safety measures we're taking there to ensure that anybody who may be COVID positive in that environment does not unintentionally infect other patients. Dr. Newman, is that something that you can also
Yeah.
speak to?
So first of all, universal masking. I mean, we're not just masking all of the healthcare providers, it's the patients and visitors when they come in are masked, and that greatly decreases the chance of spread. Again, we spoke about airflow, filtration, all those kind of situations. We are very lucky compared to many systems at this point. We early on invested a lot and worked very hard to get testing and various types of testing and rapid tests. I've talked to some other healthcare systems, and they're still struggling with some of the send out tests where they're waiting 5-6 days to see if somebody's confirmed with COVID. We have multiple types of rapid testing capable for diagnosing people and individuals. And then when somebody is identified as COVID, we have very strict protocols, units that those individuals are placed on so that they can be safely taken care of and not transmitted to our staff or visitors or other patients.
Thank you. A few of our viewers are asking questions about COVID and kids. So one question that's coming in is just asking how Mary Washington Healthcare is handling pediatric patients that need hospital admission for COVID-19 treatment. Do we have pediatric hospitalists? Are we transferring those patients elsewhere? Dr. Newman and perhaps Eileen, you can chime in as well on how we're treating those patients.
Yeah, I'm proud of our partnership with Children's National. So not only our neonatal intensive care unit, but our pediatric hospitalists, our Children's National physicians. So really one of the top children's healthcare systems in the country is here at Mary Washington Hospital. So they are actively 24/7 in the facility, and they have been very involved with caring for our pediatric population for everything, but including COVID. And we have that instant chain of command and communication back to Children's National in Washington, where lots of experts there and many different specialties. So that's something we've been very lucky to have.
Thank you. Eileen, do you have anything to add?
Just so, the way we're handling, we have a pediatrics unit that has just pediatric patients on it, nurses that are specialized in the care of pediatric patients. And then like Chris said, the real special relationship is with Children's National. So 24/7, there is a pediatric hospitalist here present in the hospital, and there are 24/7 neonatologists and neonatology nurse practitioners that are in our NICU. So I feel like we're very well prepared to take care of the smallest members of our community.
Thank you, Eileen. Another question coming in regarding COVID and kids is if children are more affected by COVID-19. Dr. Newman, is that something that you can speak to?
Yeah, so again, I think I've said before, nobody is no risk. Every single individual has risk. So I believe in Maryland, a 1-year-old did pass away from COVID recently. So it is a higher risk as we're older. It's higher risk with certain comorbid conditions, and children in general have done better and have had less severe disease and certainly a much lower mortality rate. Once you get over the age of 35, 45, you see the mortality rate goes significantly up. That being said, children are not at no risk. So children do need to be, protected. They need to be masked, social distance, all those kind of situations. And, again, it does complicate things like school and all those. And with the new strains, there's been anecdotal discussions of whether some of these new strains may create more severe or more easily transmissible within children. So that is something we're watching very closely.
Thank you, Dr. Newman. Dr. McDermott, we do have a question coming in from our community, again, regarding COVID and kids. And that is if Mary Washington Healthcare is collaborating with the local school systems to help make decisions on the safe return for students to school. Is that something that you can talk about tonight?
Well, when the schools systems do reach out to us, we're willing to give them our advice and guidance, right? But really those decisions regarding The schools, the school systems, those are left to the local school systems and their boards and the other governance structures that they have to make those decisions. But there are times where those the school systems in our community, both at all levels of education, reach out to us to ask for our advice and in how to approach COVID and the challenges that they have in front of them, and we're happy to give that advice. Those decisions are ultimately up to them. Chris, you should probably talk because you're more involved in a lot of those discussions.
Yeah, so I have been having discussions, and it's, I feel privileged, in this role to be able to help many of our community partners as they make decisions. As Mike, stated, we're not making the decision. They make the decision. We kind of advise with the best scientific data, the best information, the best public health information we have on hand. And so is the Department of Health, by the way. So we are all working together to advise many of our school districts. Right now it's a very difficult situation. Children are at lower risk for sure, but COVID is rampant in our community at this point. It is overwhelming healthcare systems across the country. The death rate is very, very high. And anytime you congregate people, it just really creates a problem for transmission. And I know Mike gave his opinion last week, and I'm very in tune with the risks of children not being in school. I have 4 young children myself. It is a very difficult situation, particularly for certain socioeconomic groups who are truly struggling with this, for parents who have to work. And I do think kids are falling behind. So there is a risk to not being in school, but right now it is really bad. COVID is really rampant in our community, and we need to flatten this curve. We do need to tamp down this transmission. So this is a very difficult situation. I realize different school districts have different resources, but right now, anytime you're congregating people, that's a significant risk, particularly indoors.
Thank you, Dr. Newman. Going back to the live Q&A with our community, we are, of course, seeing a lot more questions regarding the vaccine. And specifically, folks are wondering if they should receive the vaccine if they have a history of allergic reactions. Dr. Newman, can you speak a little bit about that and what you've learned?
Yeah, so, interestingly enough, we see this in the press, this allergic reactions that have been reported. There have been 11. Yesterday I saw a report there have been 11 significant allergic reactions to the vaccine out of the millions of vaccines that have been deployed. So that's an extraordinarily low risk for anything that we take. I think Mike before spoke about penicillin, something that we think nothing of, most people taking. The chance of an allergic reaction from that is much higher than what we've seen from the COVID vaccine. So, and the other thing is there have been no very serious adverse reactions from the vaccine thus far. People who've had a history of anaphylaxis, so that is truly a life-threatening allergic reaction. That's just not allergies or a rash. That is truly a very, very rapid life-threatening allergic reaction. They often carry an EpiPen. Those individuals probably should be monitored after the vaccine. That's most of the people who've had this allergic reaction have a history of anaphylaxis. So that very serious reaction. So we are taking precautions if people have that, but in general, the risk of this allergic reaction, we see it in the press and we're all honed in on it. But when we look in the grand scheme on a statistical basis, there've only been 11 cases.
Thank you, Dr. Newman.
That's noise, right?
Yeah.
Noise, it's not signal, right? And that's and so it's not something I don't think you should really be concerned about receiving the vaccine as some sort of allergic reaction. It's only happening in those individuals that have that history of those. And even then, most of those do not have a reaction to it. We've given thousands of doses here, some to individuals that are extremely allergic, some to individuals that have had anaphylaxis, and they've had no anaphylactic reaction to the vaccine. It's extraordinarily rare, less than 1 in a million with the odds that you just gave, Chris.
But yeah, it's important that those 11, that's not 11 here. That's 11 in the whole country with all the vaccines that have been given.
Millions of doses.
Right. So
That's some great information for our community to hear, to help take some of the fear and anxiety out of receiving a vaccine.
Extraordinarily safe vaccine.
Yeah, it is.
Extraordinarily safe.
Now, a lot of folks are also wondering how long they can anticipate having immunity from that vaccine. What have you heard about that part of receiving the vaccine?
Yeah, six months. Again, this is a newer vaccine and this is a newer pandemic, so we don't know if this will be long lasting, but definitely for 6 months. That's why it's really important for all of us to get vaccinated, get that herd immunity rapidly, and tamp down this pandemic, quickly. I think a lot of people are weighing their individual, risks on many bases, and that really concerns me. You may be a 40-year-old person without any medical problems, and you say, if I get COVID, I got a 98% chance that I'm just going to be sick for a few days, I'm going to be fine. I'm not going to change my lifestyle. I'm not going to avoid a Christmas gathering. I'm not going to get the vaccine. But the problem is, it's those 2% that are, when you're talking about thousands and thousands of people, that are overwhelming the healthcare system. They're wrecking the economy. They're wiping us out. So you truly need, and you look at the death toll, it's truly astounding. Even in the 35 to 55 age range, it's tens of thousands of people this far. So, don't play the odds on yourself, first of all. I think we all saw the report of that 41-year-old congressman who just passed away. I believe one of the state senators here in Virginia just passed away from COVID. And I was just speaking to a friend who was an ER physician in Pennsylvania, and one of their 40-year-old staff members died today from COVID. So it's tragic. We're seeing these tragic situations over and over. So many people think, my neighbors had it, a friend had it, they only were sick for a few days and got better. And that's true. Most of us will get better if we get COVID, but don't play the odds. Don't overwhelm the health system, and please get vaccinated. We need, when you have the ability to get the vaccine, get the vaccine. It's the only way out of this is if we all do this together. Don't think about your own personal odds. Think about our community.
Thank you. We are getting some questions in from our community wondering how many people we have vaccinated to date.
Yeah, so we're vaccinating as we speak practically. So it's ongoing. So it's a very moving target. We vaccinated thousands, and we have just received thousands of doses more. So we have already started reaching out to healthcare providers in the community that are either private practices that are somewhat affiliated, and we intend to roll this out as rapidly as possible to the broader healthcare community, whether you're affiliated with Mary Washington or not.
Thank you. We also have some members of our community wondering, once you've received the vaccine, can you still be a carrier to spread the virus to others who have not received the vaccine yet?
Yeah, that is felt to be yes at this point. So what we don't understand completely yet is whether if you get the vaccine, whether you could be one of those then subsequently asymptomatic carriers. You could be exposed. You don't get sick. You don't even know you get sick maybe, but you have the virus and you're able to transmit it to others who've not been vaccinated. So the recommendations going forward are to continue to wear masks, continue to social distance once you've been vaccinated.
Thank you, Dr. Newman. Can you also talk to our viewers about any differences between the two vaccines that are available, the Pfizer and the Moderna vaccine? Are there any special factors that really set them apart that our viewers should know about?
There's some minor technical factors, but not anything for the receiver, right?
I consider them scientifically equivalent, right? They're almost identical in how they were designed, what they are. I think you have to consider them scientifically equivalent.
That's exactly right.
So, I have no personal preference or thought towards either. I consider them identical.
Yeah, whichever one you can get first is the one you should take.
Thank you. We certainly recognize that this vaccine is a precious resource that's available to our healthcare providers and soon our community. Some folks are wondering what we are doing to ensure that no dose of these vaccines are wasted.
Well, we've just made an internal commitment that we're not, wasting any doses. There is a vial, and there's so many vaccines in a vial, and at the end of a clinic, there may be a dose or two left. but we have people working 24/7, and we're able to grab somebody and say, hey, we got 2 doses tonight. You're next. You're in that category 1A. So we are not shooting vaccine into a garbage can. We are using every dose possible, and we're committed to not wasting any vaccine that I think is seen. And by the nature of the number in a vial and the thawing process, so it's not like you can just throw it back in the freezer and it's good for tomorrow. So there is a very time limited once it's thawed. Once we draw it up, once it's diluted, that we do have to use it in a very time sensitive fashion. So we have plans in place to make sure that there's somebody we can get at the end of a clinic who's in that category, whatever category we'll be in at the time, so that a vaccine's not wasted.
And a vial produces 5 or 8, depending on the Pfizer or Moderna doses. It's not like a vial has 50 or 60 that it produces and you have, oh my gosh, I just drew up 60 doses. It's much smaller aliquots, and they're drawn up in real time through the clinics, not like we prepare, oh, here's 100 for a clinic. This is done in real time as we're administering them. So we're titering it very, very close, and we're not going to let any go to waste.
Thank you.
That adds a little bit to the clinics, doesn't it? Because it's looking at how many people are scheduled and then not drawing up too many, not drawing up too few. And of course, Aaron on the side of we won't waste it. So it does make running the clinic a little bit more complex, but that's part of being able to run the clinic safely.
Right.
Thank you. Well, we've talked about the status of our hospitals, knowing that we have a lot of sick folks in our 4 walls at our hospitals. Some members of our community are wondering if we will consider limiting elective or scheduled procedures while our census is high. Eileen or Dr. Newman, can you speak to that?
It's a real juggling act, and it's something that we're looking at continuously each day. Is what we learned in the beginning of COVID when we did stop doing elective procedures is that we could turn that off very quickly. But we also learned that there's not as many elective things out there. So we don't want to delay people's health care. So it's something that a number of times during the day, we look at what are the number of patients that we have in the hospital, what are the procedures that are scheduled for the next day or the next 2 or the upcoming week, and try to really look at what our capacity is. So we've been fortunate so far that we've had to do that on a very limited basis, but it is a threat that's there that as our COVID census continues to grow, it is taking up resources that then causes us to have to look at things like elective procedures and to make sure that we have the capacity to care for our community.
I think when people hear elective procedures who aren't in tune with healthcare, they're thinking a cosmetic procedure.
Right.
We're talking about somebody comes in with a cancer diagnosis and needs a cancer surgery, and they're scheduled for that, or a heart procedure or a GI procedure. These are not elective in like, well, you may not even need it. You're just doing it just because. So there are negative health outcomes when we delay these, and especially when we delay them in mass. So I will say we are looking at it day by day, and there are a handful of cases, unfortunately, that we are having to delay at points based upon our current capacity to take care of folks in the hospital. Most people are having an outpatient procedure where you're going home. That's going to be okay for now. It's the procedures where you come in and you may need a 1 or 2 day hospital stay afterwards. That's where we're having to look at those very closely. And we hate to have to make those decisions. We want to care for everybody. We want to be there to care for everybody. So that's why we continue to implore everyone to flatten this curve. And it's not being made administratively. I will say, thanks to our medical staff. So we have our surgical leadership, we have our anesthesia leadership, and we have our operating leadership and nursing leadership. They look at these cases and they really look very closely at them. And we're only looking at safety. That's about the only thing. How safe is it for us to delay this a few days? And there's a handful of cases we've unfortunately had to delay, but we are not blanket canceling elective procedures because that's shown to give patients poor health outcomes, and we want to avoid that.
Thank you, Dr. Newman. Well, we talked about the schools a little bit earlier, and we have some folks in our community wondering if it's safe for their kids to return to playing sports. Dr. Newman, is that something else that you can talk about?
Yeah, it's something we talk about on many levels. I've talked to universities about it as well. There's levels of risk, and contact sports, there's always that chance of transmission, and you have to look at is how necessary is this at this point. And when you're a kid and you have a chance to play a sport for a short period of time for your school, I understand it's heartbreaking when seasons get canceled. It's very hard. And for a kid who has a very finite time to do these sort of situations, this is difficult. But athletics is one of those kind of things where you say, is the risk there really worth the benefit at this time? In the summer, I felt very differently when the levels in our community were different. They're not. I wish we were at a 5 or a 6% positivity rate. I really do, but we're not. We're approaching a 20% positivity rate. That is a catastrophic rate. And anytime people are congregating or interacting, it's a chance of transmission, and it perpetuates this in our community. And even though the risk for those kids are low, this is what I'm trying to say. Everybody's looking at their own personal risk, and they're looking at it egocentrically, but it's like you may pass that to somebody else who has a different risk, and that person could end up into our hospital system and overwhelm the system. And it's not good for any single person in the Commonwealth if there's no health care available. That is not good for anybody. We want to be here to take care of people when they have a problem, whether it's COVID or any other healthcare problem.
Thank you, Dr. Newman. Another question from our community is wondering if our panelists here tonight have been vaccinated for COVID-19. So perhaps just a show of hands, who's been vaccinated thus far?
We've been vaccinated. We're part of our healthcare team here. We come into our healthcare hospital facility every day to do our jobs, and we've been vaccinated.
Thank you, Dr. McDermott. Another question from our community speaks to reports in the news that we've heard about how sometimes people with a specific blood type are impervious to the virus or have a different kind of recovery from it. Dr. Newman, is that something that you've heard about and can share with our viewers?
Yeah. So, there's a lot of question marks with COVID. Why does one 45-year-old get COVID and they're completely asymptomatic? Why does one get it and have significant side effects and get better? And why does one get it and get catastrophically ill or die? And we're looking at what are the different things. So blood type is one of the things that they're looking at and thinking there could be a correlation. There's nothing definitive at this point, but vitamin D levels, certain genetic predispositions, blood types, there are certain things that we're noticing trends. In science, you look at trends, and then you have to do a study to see if that trend is actually real. This has only been with us for less than a year. I think the jury is still out on much of this, and there's so many questions out there on COVID. It's a very, it's a confounding illness, quite honestly, and why it causes minimal to no illness in some and kills others. So
the best way to think of it is there are individuals of every single blood type that have caught COVID and died.
Yeah,
right?
it's true.
So it's not like, oh, I'm type B positive, I'm good. Like, no, every single blood type, everything that have had very serious case of COVID and died. So, if there's a small relative trending or something, none of that has been proven in any way. There's nothing protective about a certain blood type. You can't think of it like that.
Yeah.
Thank you. Another question from our community. Some folks are wondering if they have had COVID-19 and recovered. Does the Red Cross still need donations for convalescent plasma?
The answer is yes. I believe I saw some communication again rallying the community to get more convalescent serum, and if you've recovered, that is something you should consider. I don't know, Eileen, if you know anything.
Just that the plea is out from the Red Cross.
Yeah.
Thank you. And Dr. Newman, can you talk a little bit with our viewers about the benefit of that treatment?
Yeah. So just like the monoclonal antibody and convalescent serum, it kind of boosts the immune system and allows you to kind of clear that virus and prevent that viral load building up and causing severe disease. what we're finding with these treatments, the earlier in COVID that they're given, probably the greater the benefit. So with the monoclonal antibodies, again, that's not something we're giving to those who are very sick in the hospital. It's already too late. I do believe as they look at convalescent serum, and most of the initial trials, we're giving it to those who are sicker in the hospital with those initial trials. But I think many of these treatments, the sooner in the illness that you can give it and prevent progression to very serious disease, that's going to be what we find coming out of this. But this is a treatment we are still giving here. The hospitals are still giving, and again, the monoclonal antibodies that we are giving, we're able to deploy those even earlier, prior to somebody being hospitalized.
Thank you, Dr. Newman. We are approaching the top of our time, but I think we have time for just a couple more questions. Folks in our community are wondering about the new strain that we touched on briefly this evening. Some folks are wondering if the current vaccine offers protection against that new strain that we're seeing.
Yeah, it appears yes. We're just seeing the preliminary reports on these, and what we're hearing is it's much more contagious, much more transmissible, which is very concerning. But it does appear that the vaccines do protect against those. The concern with the RNA viruses is they're not stable. They tend to mutate. So this is something we have to be very careful with as we move forward. And as soon as we find out more, we're happy to communicate it. But I think there's a lot we don't know about these new strains at this point.
Thank you, Dr. Newman. You mentioned that it is more communicable, but does that mean that it's also more lethal?
It's not been shown to be more lethal in the initial reports out of the United Kingdom.
Thank you. Well, as we wrap up our program this evening, I'd like to offer our panel the opportunity to leave our audience with some closing remarks. Dr. Newman, would you like to start us out?
I would just like to give a shout out to our team that is really rapidly working to stand up our vaccination clinics. They've been working ridiculous hours, volunteering time, coming in and vaccinating people, before they work their shift at, 6 o'clock in the morning, after they work their shift into the evenings. And I really, I can't thank everyone enough at how quickly we are working to stand this up for our community.
Thank you, Dr. Newman. Eileen, would you like to go next?
Sure, I guess my shout out is still going to be for all of our healthcare workers that are working at our hospitals. We started tonight's Facebook Live by Mike talking about the numbers of COVID patients up, close to 100, 99, 98, 97 patients this week, the highest numbers we've ever seen. It meant that we had to open a new COVID unit at both of our hospitals. And, that means going to a group of staff who haven't been taking care of COVID patients routinely and saying, we need to do a lot of education, we need to get ready, because starting this afternoon, we're going to have some COVID patients be admitted on this unit, and you will eventually be 100% COVID. And they have all stepped up. And so I get lots of inquiries from the community about what can we do for our healthcare workers? How can we say thank you? And you can see, what's on your screen. I am just blown away every day by the things that our healthcare team is doing in the hospital, from our physicians and our providers, nurses, respiratory therapists, environmental services, the laboratory, pharmacy. They're all here. And what I hear over and over again from the nurses and the CNAs that are taking care of patients is, well, of course I'm going to do this. This is my patient. I have to do my very best. And they are well overtaxed. So thank you to all of those healthcare heroes. And at the end, thank you also to our community for your generosity in helping us take care of them.
Thank you, Eileen. And Dr. McDermott.
I just want to echo Eileen's comments and just thank you to our entire healthcare team. It's a very, very stressful time to be a healthcare provider in our healthcare system. The demand is just very, very high. And I know everybody's working in very, very challenging circumstances here. And I'm inspired every day by our team rising to meet the healthcare needs of our Fredericksburg community. So thank you to all the members of our team. And then just one final thank you to everybody who takes the time out of their evenings to tune in here to learn a little bit more about what's happening with COVID-19 in Fredericksburg, the challenges that we're having, the things that we're working on here to help make our community healthier. Thank you for helping us spread the word. I know you're trying to do that. Now is a time for action. Please encourage everybody that you know, interact with, talk to 2, 3, 4, 5 other individuals and encourage them not to share their air. Don't go into any other environments with any other individuals. Now, we need to drop the transmission rate in our community. That's what we need to do at this point in time to create a little bit more slack in our system. And so thank you for everybody tuning in and really engaging and making the commitment to do that here in our community.
Well, thank you to our panelists for sharing your expertise this evening. And as Dr. McDermott said, thank you to our community for tuning in to our virtual town hall. If you are having any symptoms and you're not sure where to seek care, you can call our Mary Washington Healthcare free triage line. Our HealthLink nurses are available daily from 6 a.m. to midnight to talk with you about your symptoms and offer free care advice. We'd also like to share a brief reminder that the Rappahannock Area Health District is hosting free COVID-19 testing. You can visit their website listed here on the screen to register. Mary Washington Healthcare will continue hosting weekly virtual town halls for our community. You can tune into Facebook again next Thursday, January 14th at 6:30 p.m. to hear from our panelists for the latest COVID-19 information. Please stay safe and healthy and have a good night.